Estelle Wigg knows Toronto Public Health says she's really only supposed to go out for emergencies. But then again, the stores are open.
I did just return something in the mall, thinking that I want to make sure that it's done before I'm not able to. But I know that I'm not supposed to be out. I feel like I'm doing wrong.
Doctors want the government to send a clearer message that more needs to be done to crack down on COVID. The Ontario Medical Association became the latest group to unite on paper, today pushing the government to lower the thresholds in its new COVID framework by as much as 50%. So when COVID rates go up, it's easier to introduce new restrictions.
Easing restrictions would be the wrong thing to do. And the reason for that is that we're seeing increased spread, we're seeing increased numbers, and we're seeing increased toll on hospitals and on the system.
It's all about keeping hospitalization rates at manageable levels so staff aren't overwhelmed by the second wave.
I'm feeling tired and I'm feeling scared and I am feeling frustrated. And I think if you asked anyone, we'd all say the same thing.
Frustrated doctors in Alberta, Saskatchewan, and Manitoba have already written their own letters to provincial leaders, demanding immediate action to get ahead of the critical care curve.
What lies ahead of us if we don't see change now is frightening.
That possible future already keeping some doctors up at night.
I've noticed, though, in myself that I've stopped sleeping as well in the last week or so, and I think it's just that anxiety building up again.
The difference from the first wave back then, there were more restrictions, and there was more goodwill from Canadians now weary from months of isolation. Katie Nicholson, CBC News, Toronto.